It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Dr. Annie Varughese and welcome back with another edition of Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives. We have a fabulous show for you today again, and let's learn more about our first doctor, Dr. C.T. Nguyen. He's an ENT surgeon helping people to breathe better. So many of our people in Houston especially have allergies, have sinus problems. Let's see how he has helped many patients in his practice.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year.
Amanda has consulted multiple Ready Clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. What they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate is a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, I can actually smell the candle.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing that's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
On a day-to-day basis, I was experiencing chronic pain, a chronic migraine all day, 24/7. I'd wake up with one, I'd go to bed with one, and it would never go away. I tried everything from acupuncture, a chiropractor, nerve blocks, spinal tap, and there was no relief with anything.
When Jennifer first came in, she was 17 years old, had been totally debilitated by her headaches, had been basically housebound, was homeschooled, hadn't been able to do all the normal stuff teenage girls do during high school, just because of her chronic daily pain. And so we decided she was a good candidate for the trial, and then when we did the trial, when she came back several days later, she'd been almost essentially pain-free from the time we put the trial in to when she came in to take the trial out.
The 5 years I experienced chronic daily migraines, I was completely limited. I couldn't do anything, stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so, and Dr. Reed decided one day somebody with headaches to try putting a stimulator over the peripheral nerves that supply around the scalp, and the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80–90% relief, that was real dramatic, and that was, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
Pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, you know, exactly what he could do for me and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
So many of us have problems with our feet. We stand on them all day long, they hurt. We're complaining of painful feet and legs. Dr. Gabriel Maislos has answers for us with regard to foot problems. He's a podiatrist here in the Houston area, and he has a special story for us today. Let's watch and see how this can benefit us.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yushova came to my office complaining of fungal toenails. Very common thing, especially, you see it in summertime, it's very prevalent. It's a fungal infection of the nails are discolored, and she wanted them treated. I
keep my body in shape, and I want to be healthy, and I want to have, everything perfect. So it's one of the things when I found out that something is wrong, I couldn't go for some time because I was busy, but I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
How do you know if you have a stomach ulcer? A lot of people have heartburn, but what's the difference between simple heartburn and a stomach ulcer? First of all, stomach ulcers are very serious. These are little erosions or scooped out areas in the stomach where the acid is eaten a hole. These can bleed and cause lots of problems. You'll know they're bleeding if you have black bowel movements. That generally is the color of blood as it runs through your intestines, and the acid changes it to a black color. But how do you know if you have an ulcer instead of just heartburn? Here's how. First of all, when you're hungry, you'll get a little gnawing pain at the pit of your stomach, and just up at the top of your stomach. Once you eat, then the food in there absorbs the acid and then you quit hurting. And then about 2 hours later, when the food gets out of your stomach, the acid's still there a little bit to help digest, then you'll get pain again. So you get discomfort when you're hungry, you eat, it gets better, and then it gets a little worse a couple hours later. That's usually an ulcer. Now there are blood tests for ulcers and even breath tests for ulcers, and there is great treatment. So check it out if you have those kinds of symptoms, but don't worry about just plain heartburn. Just eat less pizza or whatever makes your heart burn.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She's in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle. And I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club. And so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my response is, they want to know how I did it, and I'm very open about how I did it. I was like, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
For more information on any of the doctors you have seen on today's show, go to our website, bestdocsnetwork.com. Now it's time to head to our next doctor, Dr. Stephen Rose. Dr. Rose has been a radiologist here in the Houston area for many years. He has a special interest in the early detection of breast cancer. Watch this segment as we see how Dr. Stephen Rose has helped many women in the Houston area with regard to evaluating and treating breast cancer.
After having met with Dr. Rose, toured the facility and saw the importance of the work on the early detection side, I was compelled to do something more. It's kind of like once you have knowledge to do something, then you have to move forward and make sure that others know about it as well.
There are several things that we're looking for the foundation to do. One is to continue to fund important research. There's always going to be more things that we can learn and do better. The number two thing is to be able to educate both other physicians and the community, especially the community, so that people begin to understand and participate in the process of screening. Because the sad thing is, in recent years, screening mammography, especially in younger women, has decreased. And now I see women show up who haven't had their mammogram and they have more advanced tumors. I hate seeing that. We also want to try to be able to raise enough money to do more indigent care as well for those who need additional care. So those are the three main areas we're targeting.
What I love most is the fact that we're educating other radiologists to read these mammograms so that we can spread the word quickly, and also the amount of anxiety that the results of these tests provide.
Very few people really realize that almost all of the breast cancers are detected in the community. They're not detected at facilities like MD Anderson for the most part because most people are referred with the diagnosis there. So the research foundation was based on that idea that we could fund research in the community and do things that weren't being done elsewhere.
Our work is so important. I feel that we can take a big bite out of breast cancer incidences if we can move forward with this early detection. Women who are vigilant about having their mammograms annually using a 3D tomosynthesis procedure can certainly help themselves. And not just for women who are insured, but we would like for every woman to have this available to them.
Gina was looking for long-term effective birth control, and Dr. Marie Sleedman's eSure procedure was the perfect solution. To hear more about Gina's story and other life-changing stories, log on to bestdocsnetwork.com.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
External counterpulsation. What is that? It's otherwise known as ECP therapy, and it's a fabulous way of helping grow coronary arteries, renewing the blood flow to the heart when many times that blood flow has failed because of coronary blockage. Many patients are affected by coronary artery disease or plaque involving the arteries to the heart, and the blood flow diminishes, and sometimes people have heart attack. So the way that we can fix this is by placing a stent or doing angioplasty to those arteries. Sometimes we have to send patients for surgery, for bypass surgery, to help renew the blood flow to the heart. But there are many patients who are not candidates for either one of those, and they can only take medications. But now we have something called ECP therapy, external counterpulsation, where the patient lays on a bed for 1 hour treatment with massage therapy to the legs, which improves blood flow to the heart. It's time to the cardiac cycle. With that therapy, 5 days a week for 7 weeks, patients can really experience improved blood flow, improved energy, improved symptomatology. It's just an amazing way of increasing blood flow to the heart. Ask your doctor about ECP. It's great.
The need for vaginal rejuvenation isn't always talked about, but it is a common problem. Dr. Imtiaz explains why.
For a lot of women, once they've had children, they feel that sex is not the same as it used to be. They don't have control during intercourse, they don't find pleasure during intercourse, and in general, most patients would say that they feel loose. If a woman feels loose, then she has the option of having a vaginal rejuvenation done. And it's a procedure where I would reconstruct the pelvic floor muscles and also tighten the vagina in order to give her better sensation during intercourse.
Appearance can also be a cause for surgical intervention.
If a woman is concerned about aesthetically the way she looks, that surgery can also be done. As a vulva ages, you may notice wrinkling or loose skin on the outside, or some women, even as young women, notice that the shape of the external genitalia is not pleasing.
But age doesn't necessarily determine the need for vaginal rejuvenation, as young women are sometimes candidates as well.
It's not uncommon for me to see a patient who's young, maybe even in her late teens, who has labia minora that are so elongated that she's embarrassed to wear a bathing suit. And it changes their life when you can improve the appearance and give the woman a confidence that she may be needing.
Thanks to Dr. Imtiaz and her vaginal rejuvenation procedure, her patients are living a fuller, more confident life.
But vaginal rejuvenation in its true sense, it's more for tightness and function, but we can also change the way you look.
Plastic surgery is a wonderful specialty that has changed people's lives by changing the way they look and feel. Dr. Evan Feldman is a plastic surgeon here in the Houston area who has changed many people's lives. Let's look at one of his stories.
In October of 2011, I was diagnosed with stage 1 breast cancer and was advised that I needed a lumpectomy with internal radiation. Maybe a gut feeling kind of told me that I needed a second opinion. After looking at all my history, she actually recommended a bilateral mastectomy with reconstruction. So that's what I did on April 3rd of this year.
Breast reconstruction is a very rewarding surgery that we do for the patients. It's women who are going through, some of the most difficult times in their life. They've been given a diagnosis of cancer and been informed that they may lose one or both of their breasts.
I came and talked to Dr. Feldman about the whole process, and of course I was nervous, and I know I even started crying at one point, but he was so supportive and just assured me so many times I would be in good hands and I would love the results. And
so she chose to have an expander and implant-based reconstruction, and that allows her to have a reconstruction that doesn't have a second surgical site. So rather than having to use muscle from her back or from her abdomen and impacting her golf game or her yoga or her active lifestyle, we're able to use implant-based reconstruction, which is a very nice result with really nice technology that's available to us now.
Just fabulous, yes. And he did a great job, and I had total confidence in him. And I've been feeling actually pretty good. I'm kind of wanting to get out and play golf, which I haven't been able to yet, but actually I feel really good.
Every patient has individual concerns, and whether it's lifestyle, whether it's recovery, whether it's, can they get back to their job or take care of their kids, that's something that we take into consideration with every patient. The surgery's gone so well and she's so confident with her results that she wants to be out and move on with her life and put the cancer behind her, and we've really been able to deliver her a nice result that she's able to do that with.
So many exciting things have happened since then. Not only the good prognosis with the surgery, but we're engaged now. Hopefully my daughter will be graduating from college soon, and I'll be able to retire early next year and kind of just move on with my life in a positive direction.
In today's Ask the Doctor, Mark from the Woodlands has a question for Dr. Annie. Why do I need to take so many medicines for high blood pressure?
Blood pressure is regulated by multiple receptors on a cell. So if you can visualize a cell having 20 different receptors, you can realize why one medication may affect one receptor but not the others. Therefore, it's better to have multiple medications affecting many of the receptors rather than going high dose on any one medication, because high dose usually can cause side effects. So therefore, the answer to your question is multiple medications are necessary to affect multiple receptors on cardiac cells as well as vascular cells to help regulate blood pressure. Very important to take care of that blood pressure. Keep it low, protect your heart, protect your vessels, protect your life. Well, we hope this edition of the Best Docs Network has helped you to learn more about disease affecting many organs in the body and how we can prevent, evaluate, and treat these diseases. We've featured some of the best physicians in the Houston area that have helped change people's lives. For more information, for any of the fine doctors that you've seen on today's show, head to our website at bestdocsnetwork.com. If you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. See you next time.